We just welcome you to this very important webinar as we talk about industry-based telehealth programs. This is the 5th webinar in the 6-part series. And today is being recorded, and Caleb Lazinski will send these out at the end of this in the PowerPoint and the slides at the end of the 6-part series to all the participants. Guys, I'm Kim Mayo, and I'm a program specialist with the DRCHSD program, which is providing this webinar. The DRCHSD program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. And I'm flipping my own slides, so it's my own fault if I don't advance the slides, I guess. But again, today we have today's telewebinar is industry-based telehealth programs. And again, next week we'll be ending and the webinar series out with analytics to measure your telehealth outcomes. So another great webinar. So again, we do encourage discussion. You can unmute yourself. We'd love to hear from you and see you. Or you can utilize the chat box. And so we do ask, if you are not speaking, if you will go ahead and mute yourself, and so that way it cuts down on some background noise that may occur. Before we get started, we would like to hear from you. Many of you are already doing this, but if you'll find that chat box and go ahead and type in your name, your organization, who you're with, and your title or what you do there, that would help us to know who's here today. We have partnered with Huron and to dedicate this series, and so we're super excited to have them with us today. And we have Donna and Jessica. They are no strangers to this webinar. They've been here every week, and we're super excited to have them with us. Donna has over 30 years of experience in the healthcare industry and is a leader in Huron's healthcare technology service. Jess has over 16 years of experience in the healthcare industry. She's a registered nurse with extensive experience in patient care management, process improvement, and telehealth. So to start things off, I'll turn it over to them.
Thank you, Kim. Let's see, there we go, yay. So I'm happy my internet went out just as the call was starting, so I'm glad that it came back so that I could see all of you and you could see me. Technology, huh? So let's talk a little bit about what we're going to review today. So we're going to go through the power of telehealth and some new competitors for you. So it's been kind of interesting as we've been talking in a lot of our different sessions about the consumers and what they're pushing and driving for telehealth. But now we're going to talk about some of the competitors, because there are a couple of new ones that are just popping up. And then we're going to talk a little bit about employee-based telehealth trends. Jessica is going to talk about that. And then how that kind of moves into the industry-based telehealth services. So the question about why should you be offering industry-based telehealth services? And then we're going to go through a little bit about estimating the ROI of doing such a program, and then some of the considerations that you need to think about for those programs. And then Jess will review some employer telehealth program examples so that you can see some of the things that people are doing out there, as well as a couple of really great case studies. And then we'll talk a little bit, this is our favorite part, is to have our participants, all of you, talk about what's on your mind, what we've heard, and then I'll give you a few takeaways. So next slide, please, Kim. So then what we'd like you to come away with are a couple of objectives to understand some of the current trends with the employee-based as well as industry-based telehealth programs, and really to think about the possibilities to extend your telehealth programs. So as we've been working with each of you, whether it's just an assessment or moving into the implementation of your telehealth strategy, we really want you to think a little bit more about where else you can take your programs outside the walls of your house. And then talk a little bit about the return on investment, because there definitely is a return on investment for these programs, and what you need to think about and hear about what others have done. And of course, to network. So I see some new faces on here, and I see many of our familiar friends on here. So great to have you all. Next, please, Kim. And as Kim said, we want this to be interactive, so feel free to raise your hand, put something into the chat box, or raise your little hand on the screen with the Zoom. Anyway, to give your input, that would be great. Next. So what's happening? This is one of my favorite phrases, and I probably tell it to you all the time. But you know, with this topic, as Jess and I were reviewing our session yesterday, we're like, boy, this really resonates around this topic, because the consumers, as we've been talking to you, have really been pushing for telehealth. Let me be in charge of my healthcare management and give me all the information I need and give it to me fast and on an app. So what we're seeing is, and I keep this in mind all the time when I see something new happening in this area, it's just that we've got to keep in mind that our consumers at some point are going to access their care how, when, where they want it, and for the price they want. And what's so important is they're going to get it from you or for someone else. So that's why we're going to talk to you a little bit about some of the things that you can do that are kind of out of the box and creative to try to get that consumer, as we talked about last week, and have them get that stickiness with you so that they stick to your organization. You're okay, Kim. So, you know, we love this too. This is around the future of telehealth, and it's really the power of telehealth, because telehealth and care delivery don't look like it used to. Care delivery is looking very different than it has a couple of years ago. Alexa, in one of our sessions, we had our great SNL skit from Alexa. You know, we have the Apple Watches that are doing more and more for us around telling us what's going on with our health, but then also prodding us to get up and walk, you know, do the DVT walk so that you don't have any of those. It's like, hey, it's time to walk. You haven't walked for a while. The smart clothes, the Groupon apps. So a lot of providers have gone to using Groupon apps to give new patients a coupon to come for a first visit. We have the Tesla story that we've told, where a patient was driving their car, happened to be a Tesla. He was having pain, and hold on a second, Kim. And I'm just about to tell you the great story about Tesla. And he was able to talk to his car and say, hey, I'm having an issue. And the car found the nearest hospital and drove him to the nearest hospital. And it found out that he was having a stroke. So really kind of a cool story, but just when you step away from how cool that is, to think about, oh my goodness, now the cars can help us detect when something's going on and get us to where we need to be. And then the one I'm going to talk to you about next is Amazon Care. So let's go to the next screen, kid. What's the deal with Amazon? Amazon's taking over the world. I think we knew that. We loved Amazon before COVID. As COVID came, Amazon became a mainstay for us. Now they're going into the healthcare market. They've launched a pilot program, and they've been doing this for about the last year in Seattle, where they've been providing employee-based care to their employees at the Amazon facilities within the Seattle area. Now they've reached it out to their other companies within the Washington market, and their other Amazon facilities, and now they're expanding it to some other companies within the Washington market. Last week, I just read that they're going to expand to their Amazon companies in 21 states. Yesterday, hold on a second. Is it on a timer? Am I running out of time?
I think it is, because I'm not pushing it. It's just, I think it is on a timer. So I'll go back when it does that. My apologies.
Okay. But then yesterday, I found this article where it says that Amazon's now moving to all 50 states by the summer of this year. So they're moving their employee-based care, this Amazon Care, to all of their Amazon facilities within every state. Then they're going to be moving to in-person services in several cities. So now they're going to put in-person clinics in, and they're going to provide within those clinics, as you can see, medical clinic with urgent and primary care around testing, vaccines, preventive care, and some prescription requests. So let's take a minute and think about this. What? Amazon's moving into healthcare now? Yes. And so they're coming in, they're starting with their employees with employee-based programs, and now they're going to start moving to provide in-person clinics. So this is a big deal to us. You know, as telehealth, it's like the greatness of telehealth also has kind of a downside for us to think about is it opens up the doors to all of our competition. Before, we used to worry just about our competitors in our neighborhoods or who were maybe an hour or so away. But now your competitors are all over because telehealth is just opened up, you know, the gates to providing care. And now we need to be thinking about other competitors. They have a different look and feel as Amazon Care. So just something to think about there. So next, please, Kim. So what we want you to do is take your shot. As you're putting in your telehealth programs and you're looking for ways to expand it, this is the time to be innovative and creative and take your shot to do that. Because if you don't, someone else will, as you've seen with Alexa, or I'm sorry, with Amazon Care. So with that, I think I should do a mic drop. Take your shot. Don't throw away your shot. Boom. So I think let me turn it over to Jess right now. Jess.
Awesome. Thanks, Donna. All right, so we're going to start talking about the industry-based care. I also want to say that I'll be kind of interchangeable with employee-based telehealth. And that's the first slide I want to talk about is employee-based telehealth trends. So even before COVID, employers had made this big telehealth change, right? They added it to their benefit package. Even 8 out of 10 large employers, they saw virtual care and telehealth solutions as a significant role in healthcare delivery. 64% of employers, they provided telehealth to their employers or to their employees prior to COVID. So 64% were already doing this. Now, when we're thinking about the employees, the employer was already thinking, okay, this is a way to contain cost. It was convenient back to their employees, and it can be a way to provide high quality of care. So that's kind of the drivers that we were thinking about when that whole program was being developed. So on average, the employers were saving about $300 per employee per year and about $1,000 per family just with the telehealth program. So now we can say about 74% of employers are looking to expand these programs beyond just the primary care application for telehealth. And about 43% are looking into actually chronic care management and even remote patient monitoring concepts. So there are some predictions that are rolling out of where this whole market is going. Where are we taking this? So the thought is by 2023, all employers will offer some form of telehealth. And a majority is actually thinking a telehealth or a telemental health or telebehavioral health. And if you think about it, post-COVID, there's this huge push. We're all going to need it. We're all going to need some form, some access of telebehavioral health. So if an employer can offer that back, I think that's a huge benefit. Another expansion that is definitely being discussed and talked about is a virtual musculoskeletal, I had to practice that like 20 times to be able to say that clearly, musculoskeletal pain management program. So these treatments are looking at like a physical or occupational therapy for pain management. And if you think about industries and factories, I think that would be a huge benefit. And I think that's a lot of where the driver is coming from. If they have a pain in like a ligament or a tendon pain, if they can come back and have a treatment plan and provide it back to that employee to get them back to their full working ability quicker, why not be able to supply that back? Health coaching and emotional well-being support. is another area they're looking into. So it's the whole body concept for the patient or for the employee. So that's another area they're looking to grow their telehealth offering back to the employee. So now we can go to the next slide, regardless what the PowerPoint presentation says. So I kind of want to hit a pause button here and let's think about the industries that are surrounding your area. You know, whether it's a company that is small or an industry that is large, where are you thinking about potentially partnering? Are you having any conversations currently? If you want to go down to the chat box or come off mute, let's have a conversation. I'd like to know where you're going with this, what you're thinking about, and see if we can share the dialogue. Who would like to go first? Do we have somebody in the chat, or is that just a name? Oh, Jordan, are you volunteering?
I think that was just the name.
Yeah.
Has anybody started thinking about other industries or companies to provide these kinds of services with?
Hi, this is Tracy Ingram. I'm with the State Office of Rural Health in Louisiana. And we are a site designee for the Texas Telehealth Resource Center that helps our SOAR work on telehealth. And then we've recently been approached by Lamico, which is kind of gets to what you're talking about how can we support each other in telehealth work. So we're kind of excited about that conversation that's coming up soon.
That sounds like a great conversation to have. Definitely.
Anybody else?
Hi, yes, this is Judy from St. Genevieve. So our occupational medicine department actually several months ago, when we were deploying a lot of virtual visits for our physician clinics, because we have them set up in our same EMR for clinic setup, we did put together a letter that I think that they did send out to the companies that we have contracted with for occupational medicine services, that the nurse practitioner is available to do telehealth type visits. So one of the companies is fairly large and they're at least 20 to 25 minutes away from the hospital. So, you know, she was even offering to use the doxy.me to do, let's say if a guy's got a cut on his hand, that she could take a quick look at it and say, yeah, that needs to come in and get stitches, or no, it doesn't, kind of thing. So they were going to do it kind of as a triage.
That sounds great. And has that worked, Judy?
I don't know. I wouldn't, when I was listening, I'm like, you know, I know they had me help draft up a letter that they were going to send to the companies, and I'm not sure if they have actually deployed it, because we did give her access to the doxy.me account. So I'm definitely going to follow up and see if they did get that sent out, but that was the intent that they had.
That would be great. And what a great way to just start, to just do some triaging. I mean, that's a really, you know, gentle way to put your toe in the water and see how it's going to work.
Yeah, absolutely. And Ahmed is a great starting point too, I think, because it's something that your organization's already doing. And then you just branch it into the industries. Absolutely. And we'll talk more about that actually with another organization that's kind of doing that as a case study. Perfect.
And then you don't have the time of the employee driving to the hospital. Like you said, you know, it's 25 or 30 minutes away. So this way it's a quick, is it okay, or should I come in? And then you know, you don't lose all the time. So that's a really good win.
Awesome. All right. Well, if nobody else wants to add in the conversation, I guess we can move on. Okay. So types of services that are being applied to industry-based telehealth, they're a little bit limitless, but these are just kind of the basis of it and where the industry is kind of going. or employee-based telehealth is going. So the core, the starting point is usually primary care or urgent care, majority of the time. And then, so like I talked about earlier, we're definitely jumping into this whole chronic care and remote patient monitoring concept, definitely supplying back that assistant for those employees that are dealing with chronic care illnesses, and make sure we're supporting them to help with their productivity. There's also the behavioral health concept of it, making sure that they have access to the providers for the behavioral health. But then, like Judy just talked about, ACMED is a huge component of it, and injury-based care is also connected in. But there's also care coordination, making sure that there's somebody to help them coordinate their care if it's an occupational med issue, or if it's a chronic care patient that needs access to even a specialist. But then there's also this on-site care clinic versus a virtual care. And we'll talk a little bit more about this, a model later on, a use case, and talk about how some employees prior to COVID were putting on-site clinics, utilizing providers or a medic within the on-site care, but then they've slowly migrated to virtual, and then are trying to decide whether or not to come back to a on-site care clinic versus the virtual care clinic. But these are all offerings that maybe you already have with your telehealth program, or you're developing with your telehealth care program, and why not extend it to the industry-based telehealth application. So we can go next slide. I think it's important to say, okay, why should I offer this? What is the why for developing an industry-based telehealth program? So, understanding the benefits back to the employee, I think, are pretty clear. It's a quick access to care. A lot of these programs are 24/7, so not just while they're in working do they have access, but a lot of them are covering once the patient or the employee has gone home. There is an improved resource to health education that maybe they don't typically already have. There is a convenience factor, and a lot of them have an improved employee satisfaction because it is an improved benefit of care. And the employer, they have a reduced healthcare costs because they have an improved overutilization of resources that maybe they were already having an issue with, plus the absentee component of it. If they are able to see a doc much faster versus taking a whole day off to go travel to say St. Genevieve, now they can get in and get out a lot quicker. And then there's the improved productivity concept. That you're giving them maybe more preventative care. So then they're more productive in that concept. Then the health system. So you can expand the market shares because now you're reaching a bigger clientele. You have, if you think about an industry that maybe has that 200 plus employees, you're tapping into that whole industry that maybe you may have not have already been in that county or into that area. So then there's the increased utilization of your providers. We did an assessment the other day. There was an urgent care clinic. They talked about how patients weren't really coming into the urgent care clinic. The nurse practitioners were underutilized. Why not think about utilizing those nurse practitioners for now this industry concept? Higher patient satisfaction because they can access you in a different way. And then so the technology enablement could be an asynchronous model. You could maybe just be texting back and forth with that provider. If it's, you cut down on what kind of usage you're going to use for it, or maybe it is a synchronous model where you're using a platform with a two-way audio video communication. The barriers are kind of the same depending on the location of the clinic, and then I think that there's also a concept we have to remember is the language barriers. I believe one of our telehealth assessments, there was a hospital site that had a whole factory that had nothing but Spanish speaking employees. So you have to take those concepts into building out these programs, make sure that you hit all the barriers that are potentially there. So we can go next slide. Okay, so one of the important things to remember is estimating the return on investment. So what we've posed here is several questions to think about. when you're building out a program like this. Cost savings, a big important factor here. What is the cost savings to not only you as the healthcare organization, but also to the industry itself? Patient retention. Are you going to retain those patients by providing back this care so that it's more across the care continuum? And then also a new patient volume. Are you going to drive patients into your organization by creating this telehealth program for the industry? You know, staffing. Are there additional staffing requirements by building out this program? Are you going to have to build in more nursing or medics to staff that application, or more providers? Are you going to have to add those to your program? The cost of technology. What are the hardware and software costs? Are you going to be the one purchasing that equipment, or is the industry going to purchase that equipment? What's that partnership look like? You know, the program management, the design, implementation, and the continual operation of the service. What exactly does that also look like, and what's the expenses correlated to that? And then, of course, the big question we always have, and I think it's always a question in every one of these use cases: what's the reimbursement look like? What's the payer model look like? And is there any direct revenue correlated to it? So we just wanted to pose these questions as you continue to talk about this, and think they definitely should be considered. So go next slide, please, Kim. Maybe. Now it doesn't want to change slides. So another question, definitely want to pose back to the group here. What do you consider the best return on investment related to employee or industry-based programs? Certainly come off mute, put it in the chat box, or if you have any other questions, comments through the last couple of slides. But really curious, what's the best return on investment? Is it quantitative? Is it qualitative? What are your thoughts here? You know, maybe the biggest return on investment is driving the patients to your facility, increasing your patient volume.
Mm-hmm.
Hi, this is Tracy again. I'll break the ice. For
Thank
our
you.
clinics, it was the big deal of being able to still operate during the pandemic. I mean, that was a huge win for our clinics across Louisiana.
Mm-hmm. That's a great point.
Absolutely.
And you know, if you hadn't seen it in the chat box, Tracy brought up another great point of making sure, you know, one of the things we've talked about in several different presentations is different types of partnerships. And just a great reminder from Tracy to make sure that you partner with your local RHCs, because there's a lot that can happen. It's a very strong partnership. So thanks, Tracy, for bringing that one up again too.
Thanks.
Okay, Jess, we'll go on. We have more questions later.
Oh, here's Judy.
Uh-oh. Yep. Oh yeah.
Oh, this is Judy from St. Genevieve. She said agree. Oh, sorry. On the return on investment, and yes, using it during COVID. I think that I can't imagine anybody on the call not agreeing with that one too. All right. So these are some key considerations. You know, it took me a minute. I had to sit back and really think. We did a lot of work on different sites we've worked with on the workflow mapping, but this one took a little bit of a, I had to really sit here and think about how we approach this a little different, because bringing in the industry is another component to it. So there's definitely the practice flow with, you know, what's your intake that you're going to need, what's the documentation needs, the follow-up visit, but then there's also the physical environment component of it. Thanks, Kim. So the privacy, you know, if they're seeing the patient in the work site and you're logging into the application, so how are you going to create that privacy in the work site? But then there's state laws for practicing, you know, the same reimbursement guidelines, you know, that are constantly changing. So we have to be cognizant of that. But then there's the compliance with the employee policies. You know, can they access the application during working hours? What's the workplace safety guidelines? Reporting the injuries, electronic use during, did I already say, I might have already said that, the slides are messing me up a little bit. Communication, the HIPAA guidelines. And then there's the informed consent components, obtaining it, locating it, documentation, and then the healthcare system. How are you going to contract with the industry? What are the professional fees associated? And then the support services, what are the wraparound services? So now you have this ACMED application, and now that patient needs to get x-rays or they need to get lab draws. How are you going to handle those components of this? How are you going to contract that out with that industry? So all those considerations together, I think once you kind of put those buckets together, that's how I think it's best to establish that telehealth practice or the program. Now we can switch slides. So I wanted to provide back some program examples. These are employers who have offered it back to their employees. So Huntington utilized Teledoc. And what they found is they were able to reduce emergency room and urgent care usage through their offering. They have saved time and reduced cost for their employees. And their program definitely found that they were able to improve primary care services for their employees and definitely made it more accessible. Telemundo, which I think if anybody's had cable, they know Telemundo. It's a Spanish-speaking TV network. They actually had 80% of their employees enroll in their program through Crossover Health virtual services. What they did to drive utilization is they waived or reduced the copays for their employees. And a lot of organizations do that to, once they do an initial launch, they'll either give a coupon or they'll waive the fees. That's one of the initiatives we find a lot of times. Bowman Health, it's a mental health center. They utilized Health Joy for their virtual care. They actually waived complete copays or the initial fee. So their first month, they had about a 40% utilization, but following that, it was about a 70% the few months following it. And they actually found that their program was a benefit to their employees for attracting and bringing in new talent. Adecco was partnered with Amwell for their telehealth coverage for their employees, and 44% initially enrolled in the program, and it's been driving numbers ever since. And this was prior to COVID, this program. But what I thought was really interesting, they found a savings of $230,000 for compared to alternative healthcare expenses. And that's like accessing emergency rooms and urgent cares is how they found the majority of their savings. So some great examples of success for employer-based programs. So now we can go next slide. So UTMB, University of Texas Medical Branch, they have a program called Medicine at Work. And it serves employers for like 200 plus. I think they're located in 8 states, I believe. But they're all about creating that healthy employee to be a more productive employee. It's the convenient and expensive access to providers for that healthy outcome and reducing cost. They want to keep the employee out of the emergency room and out of the urgent care, and it's more driving that preventative care model. So they have the virtual program, which is accessing their app, their smartphone app, and they are also in a Walmart, CVS, Minute Clinic, Exxon, Mobil, and Cleveland Clinic. They also, this is the one that has that on-site program. So what they do is they pitch back to the industries that will come to you, will set up your on-site clinic. We will provide the furnishings, the telecom, the telehealth equipment, and we'll also staff it for you with no upfront costs, no build out or long-term contract. And what they do is they put in a medic to do like the triaging of the patient, and then they connect to the provider via telehealth, and then the provider assesses the patient, diagnoses, and then provides back a treatment plan. And then the medic is also a health coach. So that's their model throughout those states. We can go to the next slide, Kim. And then Concerta, they also do a telemedicine at work program. It provides 70 or 24/7 access for telehealth services. Another convenient modeling, so there's no travel for the patient or the employee, a limited amount of missed work, early intervention, medical expertise. This is more geared towards the ACMED modeling. So they're doing physical therapy, injury rechecks, and also return to work evaluations, but the patient never travels, never has any face-to-face encounters. It's all telehealth based. So the kind of the workflow here is the patient has the injury, contacts their supervisor, the supervisor prompts them or sets them up in the system, then they access the telemed app, which they contact a care coordinator. So care coordinator creates all the accounting. Then they are, once they're on the application and through the care coordinator, they're able to access a provider. The provider evaluates them all virtually, diagnoses them, and then they get a treatment plan and are able, the provider then reconnects them to the care coordinator, and then they're discharged. Okay. All right, Kim.
All right. And this is the part where we'd love to hear from you guys. I do apologize for the slides having a mind of their own. But we would love to hear from you guys about any of these questions as far as industries in your area that have solved healthcare needs, any benefits, that you guys see as far as how does your organization align with industry-based telehealth program, biggest challenge that you guys see coming up, and then again, that return on investment question.
What
And also,
do you guys think? This is an area that you've probably seen, heard about, thought about. What are you thinking now that we've talked about a few more additional points? Is it an area that you think you want to move into? Judy, you're coming off camera.
So, I think our challenges, and I was trying to remember, I think when we were working on that letter to draft it, it was our community and our employees had gotten hit by COVID. So, I think it's just the timing. So I did reach out to find out, did we ever go that far? Did we get it deployed? I think some of the stuff that Jessica was talking about as far as, like handling HIPAA and I remember them discussing that they were probably going to leave it up to the employer on whether the employee used their own phone to dial into that doxy.me telehealth visit, or whether they were going to have the supervisor, like sign into it and then give the phone to the employee to do. So I know that there were some discussions about that, and I know there were discussions about the charges, and I'm not aware of what they ever decided to do, is because it's different with ACMED, with occupational medicine, than it is for, a normal private insurance on how you can charge, or whether they were going to be the charge for that. So I know there were discussions around that, and some of that may have all gotten delayed. So I don't have clear answers either, but I know that there was a lot of discussion about those points.
Yeah, and the reimbursement comes up all the time. So no matter what you're trying to do, so whether it's this type of a program, or, just as we've been working with you on setting up your basic telehealth programs, reimbursement's key. And, the one thing that we just keep recommending to all of you is just stay on top of the sites within your states about what's happening, because it changes all the time. We have a client in Massachusetts, and their state just passed 2 more years of telehealth for phone visits. So that was very encouraging for them. So it's changing all the time. So I think that you need to just continue to stay on top of that. That's a key thing, which you do anyway, but that's how we do. There's a great source out there that lists all the different guidelines and regulations state by state, almost minute by minute. So it's a good resource for that. And then Tracy, as you said, it does have to be easily accessible for patients and users. So, that's key. We've talked a lot about the different barriers to access. So what are the best ways to reach out to your patients? Is it just through a phone? And so if it's something that you can do, is it a phone visit? And we were just talking a little bit this morning. We were getting ready for a session on health inequities. And we were talking about, there's some of the things that you can even do through text. So does everything have to be done through a phone, a voice call, or a video call? Can some things be done through text? So it's really just challenging ourselves to think about things a little bit differently and how we can reach the patient and reach them where they're at. I think that that's important. And then I'm not sure if it ties to section 125. Does anybody know that answer? We can follow up on that, but I don't have that answer right now. Good. Do you think this is something that you'd be interested in doing? Because the reason I ask is because this came up as one of the topics that you wanted us to delve into a little bit more and give you a presentation on. So is it something that you're thinking about doing? Yeah, so you were going to go and look into it? Yeah. I think that's a good path, especially since, and I just sent the article about Amazon's Care to Kim, and she's going to get that out to all of you so you can see the details. But they're not the only ones. Google's coming out with care opportunities. I want to call them applications, they may not be, but care services. So more and more of typical industry providers are getting into the healthcare market, and they're using the technology to do it. So I think it's a good topic. It's very timely, and it's something to go back and think about. What does this mean for us? What's happening in our environment? Who's in our neighborhood that we can reach out to? Like Judy said, they had a really nice setup with an organization that was 25 miles away. And, let's see if we can provide them some occupational health services, just even to triage it. So something kind of simple. So just some things for you to think about as another area to move into with your telehealth programs. So good. Well, Kim, how about if we go to the next slide? And Kim, if you could build it all up, yeah, that'd be great. Or maybe it's going to build on its own. The slides have a mind of their own today. So we'll see where the slides are going to take us. It's a good thing that we're so flexible, Jess, with the slides. So if I could give you any one thing to take away, this is my favorite thing to keep in mind with everything that I do. The consumers are going to access their care how, when, where, and for the price they want. And if they're not getting it from you, they're going to get it from someone else. So keep your consumers in mind with everything that you're doing around your telehealth strategy and program. And that care delivery now is coming in many different forms. It's not just coming from your organization and all the different ways that you provide care. As you saw, it's coming from a lot of different places. Your competitors look and feel different now, and that employers really are looking for virtual care to be a significant part of their healthcare delivery. And in a couple of years, most US employers are going to have virtual healthcare offered to their employees. And that the employers want to grow their virtual care. So looking to provide primary care services with just a couple of areas that we have listed here below, just some areas to start with and see how it works and then determine how you expand it. Jess had that great slide of things that you're doing or planning on doing with telehealth right now. So how can you just move on and provide those? And that you can expand your telehealth services into the industry-based telehealth services. And then as you're thinking about it, we've given you some questions to consider around the ROI estimates and some program considerations. So let's see, Carrie has the analytics capabilities of Amazon, Google, and others are far beyond what a typical system can do. And that's true. Carrie just joined us recently from the Cleveland Clinic, where she built their telehealth program. And that's so true. We know that with a lot of our systems that we have, the EHR systems, even the largest EHR systems that are out there, many of us are struggling to get data out of them. So then when you look to some of these competitors that we're talking about, their analytics are pretty solid. So just some things to think about. Carrie, thanks for bringing that up. Well, is there anything else you wanted to talk about or mention or have the others on the call think about? Okay, let's see. Lisa. Oh, yeah. So Jess, Carrie, let's look at the malpractice legal aspect. What problems have we seen? Because that's a big question that's coming up now. Carrie, did you have any experience?
I actually directed the quality under this area.
Yeah.
And I must say that we were very fortunate not to have any medical legal problems. We did have some complaints that went to the ombudsman, but I would say the vast majority were the fact that patient expectations did not align with the service they received. So for instance, what an example would be, I believe I have 100% have a sinusitis. I was not given an antibiotic because I didn't meet criteria to be diagnosed with sinusitis. So therefore, this provider provided me no care. And so therefore, I don't feel I should pay for it. Mm-hmm. So it was more of those type of complaints. And again, there were some issues with connectivity and some challenges. And again, I think it's a slightly separate issue. But mm-hmm. those were some of the challenges that our patients would voice most often mm-hmm. In actually engaging using our telehealth platform. Mm-hmm. But we were very fortunate at this point in time, but we have a very robust quality program behind what we've been doing. And it was really built by design with that as the foundation before we at the clinic, I should say, they did before they really started their programs in all ways. Mm-hmm. And in regard to physical exam, just as a separate issue, is we actually built templates, and you might consider that to have a template in there and do some education to providers to encourage them as to what are the appropriate things you can do virtually, and if not, have a low referral in threshold, so that you have, you're pretty safe in your quality, and then as you grow and feel more comfortable, expand that the opportunities in the physical exam.
And some of that we've done workflow sessions with some of you on the phone. That's part of what we were looking at too, is to identify what things you felt comfortable, the providers felt comfortable providing with telehealth versus having an in-person visit. So that was a key part there. And Carrie, when you were at the Cleveland Clinic, did you make sure that you included some of those things, like in the patient consent, to kind of help set their expectations for what was going to happen through the virtual visit?
We did, and as over time, it was an iterative process. So the consent got more robust as to set patient expectations. And usually, again, it was learning. And I think in this space, patients learn as we learn, and realizing that we're not going to have it perfect when we first launch everything, and that we may have to redo it again in regard to helping clarify. you know, what can be done, what can't be done, and what should be an inpatient or a face-to-face visit.
Mhm. But you know, we'll do a little, and so thank you, Carrie, and we'll do a little follow-up on this. I know that we've had this question before, and as Jess and I have researched it, we really haven't seen too much yet in this area, thank goodness. But we'll add it to our follow-up list to see if there's anything that's come out lately.
Donna, I was just going to say, I think the big driver in this realm is more around the quality and how to measure the quality of a telehealth encounter.
Right.
And I think that that's what we're going to be seeing over the next year, if you want to say a post-COVID approach, is how to measure the quality of a telehealth encounter. To actually say any misdiagnosis of a patient through telehealth, there hasn't really been a lot of a talk from a malpractice or a legal aspect, Lisa. Lisa, I don't know if you want to come off mute and say if there's any other any follow-up questions around this specifically, if you want to give any more detail to your question.
Or did we answer it?
Yeah.
Sorry, this is Lisa Madison.
Hey.
That was just one of our initial concerns from some of our physicians on site is how to handle, or basically too, if the malpractice insurance would cover situations like that.
Oh, okay.
Got
So
it.
that was just kind of an initial concern that they had going forward.
Yeah.
Well, let us follow up with you on that. Let us do a little research.
Okay, thank you.
You're welcome. That's a great question though, too. And I like where this took us into the quality piece, because that's an area that we haven't talked about yet with anyone, but really moving into how to measure the quality around your telehealth so that you can avoid any of these kind of legal issues, kind of like what Carrie brought up, the difference of what was provided versus what the patient thought they would get. So we're going to follow up on that one too. So good question. Okay, anything else that you can think of? And if not, you know how to get a hold of us. So we're going to turn it back over to Kim Mayo. Kim. And you need to come off mute, Kim.
Either the operator has lots of errors today, or this computer is like haunted today. I'm not sure, but could be a combination of both. But we appreciate all the sharing of the information and the great discussion today. Thanks for sticking around with us. This is our contact information for myself and Donna and Jessica, and we'd love to talk further about anything that was discussed today or anything related. And we thank you all. We thank you for, of course, Donna and Jess for sharing their knowledge and expertise with us. And we thank you all again for just joining us today and being a part of today's session. We invite you back to next week, the finale, the part 6, as we discuss telehealth analytics. Same time, same location. And we'll have Jessica and Donna with us, as well as Mark Saxon, who's been here with us prior. And he's just great at what he does, and a great communicator and presenter. So I know it'll be well worth the hour for sure. And with that, we just thank you all for being here with us today. And we wish you just a great rest of your Thursday and the great rest of your week. And we'll see you next time.